Good afternoon. My name is Brenda Suggett, and I'm the Executive Director of CARSP, or the Canadian Association of Road Safety Professionals, and welcome to today's webinar. Today's webinar is entitled Automated Speed Enforcement in Toronto School Zones, Evidence of Safer Speeds. And we have the privilege of having Dr. Linda Rothman with us today, and I will introduce her in just a minute. But first of all, I just wanted to talk to you a little bit about CARSP. So in case you are new to CARSP, we're a national nonprofit organization. We're basically a community of road safety professionals, and we support them through things like an annual conference, education opportunities like these webinars, resources, and networking opportunities. So if you haven't had a chance to check out our website, I invite you to do that and learn more about us at carsp.ca. And these monthly webinars are actually free to our members, and membership is very affordable. It's only $125 a year. We did, because of the highly anticipated nature of today's webinar, we actually had a lot of people register, 82, and we opened it up to not only CARS members, but ITE Canada members for free because we wanted to get the word out. And I'm sure if you've been following the news, you know how important and timely this topic is of automated speed enforcement. From an Ontario perspective, it's extremely important, and actually even today, legislation is being tabled to take away ASE from municipalities, giving them taking away that power for them to have an ASE program. So we haven't heard any news yet what the outcome of that is, but we felt it's very important to get this evidence out there. I know that Dr. Rothman has also already presented at our conference and in other ways, but I think there's still a lot of people who haven't heard her study. So that's the reason for today's webinar. It's an extremely important topic. And I wanted to, just before I introduce Dr. Rothman, I want to also just touch on some housekeeping items. First of all, that uh, after the presentation, Dr. Rothman will be taking questions, so they won't occur until the end. But you can actually submit them at any time, and we request that you do that using the Q&A function at the bottom of your screen. And once again, you can do that at any time during the webinar, but we will only be addressing those at the end of the webinar. Secondly, I wanted to mention that we do have a post-webinar survey, and HOMA is going to be placing the link to that in the chat area. This is just good feedback for us about today's webinar, about and other topics you'd like to see us present on in the future, because these webinars are monthly, so they are on a regular basis. And we'd love your ideas in terms of what topics you'd like to hear. The other thing, oh yeah, and it is an advantage, sorry, as a added incentive for you to do the post-webinar survey, we actually are giving away a $25 Tim's gift card, Tim Hortons gift card. And I am excited to announce that the winner of the last Tim Hortons gift card is Majday Sharafi. I hope I pronounced that correctly. So congratulations to them for winning the last $25 gift card. And we give those away every second or third webinar that we host, depending on the numbers of people that register and so forth. So without further ado, I will now introduce Dr. Rothman. So Linda Rothman is an associate professor at the School of Occupational and Public Health at Toronto Metropolitan University, and is also an associate professor in status only at the University of Toronto. She is an epidemiologist with expertise in vulnerable road user injuries in urban environments. She holds several Canadian Institutes of Health research grants, including the Healthy Cities Capacité Implementation Science Team grant, involving researchers working together with municipalities across Canada and Australia to examine the implementation and evaluation of interventions focused on speed reduction and all ages and abilities bicycle networks. So without further ado, welcome Dr. Rothman. Thank you so much for coming, and we look forward to your presentation.
Thank you so much for having me and for that introduction. I'm just going to bring up my slides. Hold on. I don't think it's got the right.
No, I think you have to still click the presenter view. Now you have to swap the screen. We see, there you go. Perfect.
Okay, sorry about that. Thank you so much again for the introduction, Brenda. As we all know, this has become a very hot topic, particularly in Ontario right now. There's been a lot of back and forth with the Ford government about the effectiveness of these things and whether or not basically we should have them in the province. And I do, as Brenda mentioned, this is very relevant to other provinces across the country because these questions keep coming up. So I'm from the School of Occupational Public Health at Toronto Metropolitan University. It's an interesting, I always find it interesting that I'm from public health. I'm not a road safety or road traffic engineer. I work closely with a lot of the city planners and road traffic engineers, but I'm looking at this from a public health perspective in terms of injury. So just for a little bit of overview, I'm going to do a little bit of introduction and some background. I'm going to talk to you about the methods, the data collection, and the outcomes that we're looking at. Our results include some data visualizations in terms of graphs and some results of regression models, summary, some future directions, and then I'll take some questions at the end. I have to introduce the whole research team. We've been working, there's a whole group of us that have been working on this research from SickKids, so Dr. Andrew Howard, myself, Sorora Subar, who's also from Hospital for Sick Children, Brice Beitomen-Kiumi, he's at the Dalalana School of Public Health, Dr. Alison McPherson, who's at York, and Marie-Soleil Cloutier, who's a professor in urban studies at the Institut National de la Recherche Scientifique. The other important thing about this was it was a very collaborative project with the City of Toronto, who provided the funding for it. We worked really closely with transportation services on this. I do want to say that I did present some of this material to City Council on Thursday with a representative from the City of Toronto, and although they couldn't be here to present with me, they did give me permission to use some of their background slides. So this is from both of us. The results of the research that I'm going to be presenting has been recently published, and it was very opportune right before all this happened, just a couple of weeks before all this came out with the Ford government. And this was published in Injury Prevention, and it's a study called Automated Speed Enforcement, Reduced Vehicle Speeds in School Zones in Toronto, a prospective quasi-experimental study. So this came out just before all this broke. So there's been a lot of demand to hear about what the results of this study were. So why is speed management important? Road traffic crashes are a very significant global public health issue. And that's prompted a lot of effort on protecting especially vulnerable road users, so pedestrians, cyclists in urban settings. The World Health Organization has stated that road traffic injuries are the leading cause of death for children and young adults aged 5 to 29 years. That's worldwide. And we know that vehicle speed is a key determinant of the probability, so whether or not the collision actually happens and what the outcomes are, how severe they are, if they are fatal. So vehicle speed is a key determinant of this. The 2023 Ontario Road Safety Annual Report found that over 20% of fatalities were speed related. And again, the World Health Organization states that reducing vehicle speeds is one of the most effective methods to save lives and prevent injuries, especially for pedestrians and cyclists. So we really, really do need to focus on speed management. Just as an example here, this is adapted from the World Health Organization. The City of Toronto used this slide, which I thought was really effective. At 30 kilometers per hour, there's a 10% likelihood of a fatality. 40 kilometers per hour, so only 10 kilometers per hour more, it's a 30% likelihood of fatality. 50 kilometers per hour, an 85% likelihood. 60, 95% likelihood, and at 70 kilometers per hour, 100%. So you can see when people are saying, I'm only going 10 kilometers over the 30 kilometer speed limit, look at what the difference does in terms of risk of a fatality. So 10 kilometers per hour can make a huge difference. Look at the difference between 40 and 50. It goes from 30% to 85%. And the graph down at the bottom right kind of shows how steep that curve is. So automated speed enforcement, the lovely box on the right, is a system that uses a camera and speed measurement to detect and capture images of vehicles traveling in excess of the posted speed limit. It's supposed to be working with other methods and strategies, not just on its own, including engineering measures, education initiatives, and traditional police enforcement. It's supposed to be used in conjunction with a bunch of other things to reduce speeds. It was legislated under the Safer School Zones Act in 2017, which allows municipalities to use ASE in designated school zones and community safety zones. So basically, the ASE is focused on changing driver behavior to decrease speeding and increase safety. Our Vision Zero goals. So to get ourselves down to 0 fatalities and 0 severe injuries, school-age children are one of the vulnerable road users that are targeted in the Vision Zero road safety plan. In 2020, in the City of Toronto, the automated speed program was initiated with 50 mobile camera units as part of the Vision Zero plan to reduce speeding. So 50 mobile means that they move around. They don't stay put. They usually stay about 3 to 6 months, and then they move to a different location. It's designed to hit community safety zones near schools, and 95% of cameras are currently near schools. So they are really, really focused on our most vulnerable population, which is school children. So we started with 50, we went up to 75 cameras in 2023, and we currently have 150 cameras that are moving around in the different wards. Why do we want them near school? We know that transportation crashes are a leading cause of death and injury in children in Canada, with over 15,000 in 2021 alone of injuries and fatalities. Trail pedestrians, we know, are much more vulnerable to collisions because they're small and they're making them much less visible, and it makes them more prone to head injuries. If they get hit in the head, whereas we may be getting hit in the leg or the lower torso. Children have less ability to detect and manage traffic risk as compared with adults. And again, we've done research in the past where child pedestrian injuries are really concentrated around schools. So in the community areas, on the local roadways, despite the presence of school zones, which are designed to protect kids. I've showed this picture many times before. Some of you may have seen it. But this was back in 2015 with some data collection we were doing years ago, looking at how kids arrive to school and collisions around the school. So how many kids arrive by walking, driving, and by bicycle. We also were looking at driver behaviors and how people were driving around the school, whether they were dropping kids off across the roadway, how they were whether they were backing up without looking, that kind of thing. The red car in this picture was one of our students who was there to do the data collection, and a car was driving fast enough during right before school hours. It was 8 o'clock in the morning that they managed to come down the road in front of a school and hit the door of our student's car and flip themselves. So if you can imagine how fast that car was going, to be able to do that, it's unbelievable that this was happening right in front of a school at almost school attendance hours. So from the City of Toronto, we found out that the site selection, the methodology is based on provincial guidelines and best practices that have been learned from other North American jurisdictions. They picked the community safety zones and prioritized based on how many collisions had involving children had happened in that area. How many collisions where there was a vulnerable road user killed or seriously injured? They also looked at the speed data. So very data driven, this the selection of where they were putting them initially. They looked at 24-hour traffic volumes. They looked at the percent of students within walking distance of the school. So they got that information from the school. And they also considered requests from police and the public. So that's how they went about initially selecting the sites. And then they do a manual review of the sites, looking at the appropriateness of the sites. For example, is there any other traffic calming measures? They don't want steep slopes. Is there an appropriate place to put the camera and things like that? So it's a two-step process. In terms of previous research, automated speed enforcement has been used in all sorts of different settings, highway, rural, and urban, but it really did start mostly on highways. And most of the studies that we see come from highway environments. And there is evidence everywhere, basically, that it does reduce speed, it does reduce average speeds, it does reduce crashes, and it does reduce overall injuries. But I do have to just call attention to the wide variability in the results. These are kind of a summary of a whole bunch of different studies. It reduced speeding from 14 to 65%, crashes from 8 to 49%. So there's a lot of variability in the results. Overall, they are protective for collisions and are effective in reducing speed. But there's been a lot of design limitations associated with the studies that have been done previously. A lot of them are very small numbers. Like there was a previous study done in the US by Kesberg around schools, but it was only 4 schools. So very few numbers. Also, things weren't controlled, like they didn't do pre-speed measurements. Things like they didn't control for whether or not there was other traffic calming. So that accounts for some of the variability in these results. The other thing is that urban areas have not been well studied. Most of the studies came from the highway environments. So we found that no other study had measured speed changes actually using pre and post data on a large scale with ASE in lower speed urban pedestrian areas. So that's how this study came about. So we worked with the City of Toronto. Again, 50 cameras were the initial deployment, 2 per ward, and it was executed in 6 phases. We had our phase 1 warning, and then phase 1, phase 2 warning, phase 2, phase 3, phase 4, phase 5, phase 6. What I'm presenting is the data from 2020 to 2023 up until the end of phase 5. Each of the phases range between 3 to 6 months, and they represent where the camera is. So it was deployed for 3 to 6 months in one location. There is, by law, a minimum of 90 days warning given to road users, employing regulatory signage regarding upcoming enforcement. So that has to go in, and that's when the tickets are not being given out. And then again, upon completion of a phase, the units are rotated within each ward to a new location. So there's always a certain number per ward. And you can see here, these are phases 1 to 5. The colors don't really matter too much. They just represent the different phases. But you can see that these cameras have been put kind of all over the city. So they're scattered from east to west and north to south. So the data that we collected, we looked at before the ASCs went in, and we collected that speed data using pneumatic road, the tubes. And we did that on 3 consecutive weekdays between 2018 and when the camera was actually installed. And we were able to do this for 204 locations. Again, the collaboration with the City of Toronto is essential to this kind of thing because we can't go out and measure speeds. Then there was the warning period data. We only had that available for phase 1, but we did look at it for 44 locations. We then collected the ASE period data, so when the camera was actually then. So we looked at vehicle speed and volume, and it was over 250 locations. Then we also, at the same time, we collected with the tubes at 24 of these sites simultaneously for validity checking. So we wanted to see whether or not, because we're looking at pre-data using tubes and ASE data using the cameras, we wanted to make sure that those data actually were good together. They actually can like work together well. Then we did post ASE data using tubes again, but only at 38 locations we were able to do. And it was on 3 consecutive weekdays between 28 to 45 days after ASE. A lot of logistics involved in this data collection. What we looked at were the percentage of drivers exceeding the speed limits, and we categorized them by 30, 40, and 50 kilometer per hour roadways. And then we also looked at the 85th percentile vehicle speed, which is the speed that vehicles travel, free-flowing vehicles travel, 85% and under on a roadway, and they use that frequently to help establish speed limits. We did descriptive and graphical analysis, stratified by posted speed limits. We just to be, I wanted to make sure that everybody knows that we took out any area that had co-intervention. So any schools that also had a change in speed limit or an addition of traffic calming during this period, we did not include because we really wanted to focus on the effects of the actual cameras. Then we use generalized estimating equations, GEE modeling, using fixed effects, negative binomial regression models to look at the percentage of drivers speeding afterwards, and then the linear regression for the 85th percentile speeds. We did account for seasonality in our modeling, and we only included the weekdays because we wanted to make sure the pre-counts could only be done on weekdays. So we wanted to make sure that we were sticking to the same scenario, basically. And then we looked at the subset of 37 sites that had both pre-ASE and post data to see what happens once you take them out. And as I mentioned before, we looked at the agreement of measurements between the road tubes and ASE, and they were highly correlated. So the cameras and the pneumatic road tubes were measuring basically the same thing. So just to go over quickly the characteristics of the automated speed enforcement sites. The speed limits, most roads had a speed limit of 40 kilometers per hour. So if you look over on the right-hand side, that's the totals. These are the some of the 5 phases. So 58% had a 40 kilometer per hour posted speed limit. And it looked like local, collector, and arterial roads were all pretty equal distribution, maybe a little bit more on arterial roads. Okay, this is an important slide. So basically what we see here, it's January, it's the first phase. So this is just one example, and the pattern was very similar for every one of the phases. This is the proportion of vehicles speeding, 50 cameras. If you look at, there's school closures. This happened right when COVID was hitting and school reopening. You can see that on the slide. You can see where the warning periods were, and then the ticketing period, start of ticketing. And then what I want to call attention to is like the light greens, the light green, dark green, or the amount of kilometers over the speed limit. So 1 to 5 kilometers over the speed limit is a light green, and then it progressively gets higher and higher to 16 to 20 kilometers or the orange, and over 20 kilometers per hour of the speed limit. You can see the big drop that happened at the start of the ticketing. And you can also see that a lot of the drop happens in the people who are going the fastest. So this, I mean, there's a drop here, but you can really see that the red and orange really, really go down. Okay, and then the school reopenings didn't seem to have a huge effect, but you can see it's gone down and stayed down while the automated speed enforcement is there. So when you look at the results of the modeling, the percent of vehicles going over the speed limit with the camera, so ASE period excess speeding on the left, the models, there was a 45% drop overall. If they were going over 5 kilometers per hour, it was a 62% drop. Over 10 kilometers per hour, a 74% drop. And then 15 kilometers per hour, 84% drop. And over 20 kilometers per hour, 88% drop. So if you have one here, that means there was nothing significant happening, but everything else had gone down, and the increase in the percentage drop increases with the amount of speeding that's going on. The 85th percentile speed, overall, it went down by almost 11 kilometers per hour, minus 10.7. Where there was speed limit, posted speed limit of 30 kilometers, a little bit more, 11.5 drop. Where the speed limit, posted speed limit was 40 kilometers, around 9, and speed limit 50 kilometers, around 10.6. So again, substantial decreases in the 85th percentile speed. This just shows this kind of graphically. Speed limit on the left, 30 kilometers and 40 kilometers and 50 kilometers. The top row shows the before the automated speed enforcement went in. The bottom shows when it's in, and the speed limit is the solid line. The dashed line is the 85th percentile speed, and you can see that they go down. If you follow from the top to the bottom, you can see how much it goes down the dotted line. Now, the other thing that we did do is we looked at the 38 sites where we removed the cameras to see what happens once they're removed. Although all these sites had a substantial reduction with the camera, once we removed them, unfortunately, the speeding went back to where it was before the cameras went in. So that's something we can talk a little bit further about. So the strengths of this study is that was a comprehensive data collection effort, including pre-ASC, post-ASC, the warning period, with a robust data analysis. And again, I have to emphasize, this was a large study with 250 locations that has not been done before. It's a representative sample. We got data from a lot of sites, and therefore the study's statistical power, and it had power, and it was also more representative of real world conditions. And again, all of this has direct policy implications. These automated speed enforcements, cameras do work to reduce speed. The limitation, it's a non-random camera placement. We couldn't randomize, and we know that random allocation means that you've controlled for everything. It's a criteria-based selection, but this is how real-world research generally tends to work. The data availability, we didn't have a lot of pre-automated speed enforcement data at some sites. And also, we do have to recognize that this was during COVID-19. Maybe the pandemic lockdowns and school closures had some effect on driver behavior, but you did see that in the graph that there wasn't a huge difference once the schools were closed and reopened in terms of the speeding after the cameras went in. So basically, the percentage of drivers speeding over the speed limit and the 85th percentile speeds dropped very significantly during ASC near school zones. Despite the overall success of automated speed enforcement and lowering vehicle speed, there is still extreme speeding in some locations. We have shown that it's an effective way to manage speeding and may be used to complement some of the other strategies that the City of Toronto uses in terms of Vision Zero. And I feel, and many others feel, that these cameras are absolutely essential for the safety of our children. I do want to put this one last before we talk about future directions. This is something the City of Toronto presented the other day. There's been a lot of talk about cash cow, cash grab. This money is just going back, the cities are grabbing this money. The City of Toronto did do a breakdown of where the money's going from the automated speed enforcement. They collected 37 million in 2024, and they've allocated to three main purposes. One is the provincial remittances, almost a quarter. They go back to the province. This includes the victim fine surcharge and the fee paid to the Ministry of Transportation for obtaining the license plate ownership information. So we need to know whose car it is that they're ticketing. About 35% goes back directly into the city's cost to administer the operation. And the third one is about 41%, and it enables the city to invest in Vision Zero initiatives. So it goes into the Toronto Police Services Road Safety Program and all sorts of different Vision Zero safety measures. So you can see that this money that is being generated is not being put to waste. is not frivolous. All these things are going back into road safety initiatives. So I just wanted to emphasize this is an excellent example of a fantastic and successful collaboration between municipalities and academic public health researchers. We have worked with the City of Toronto for many years and have a great relationship with them. They're supportive of our research. We're always there to discuss research initiatives with them as well. The next steps we do want to do is this looked at the impact on speed. We really would like to look at the impact on collisions themselves. That takes a longer time with more data. We're at that point now where we could be looking at it. We do have multiple other cities that we're working with through our implementation science team grant capacity that have automated speed enforcement. So our plan is to look at the effect of collisions on multiple Canadian cities. We have put this grant in several times to CIHR. We haven't had it funded yet. It's in again. Hopefully we will get this funded so we can actually look at the collision outcomes. We also have had a few questions about why do cameras work better in some areas or some locations than others? Is there things in the environment around it that make some ASE cameras better in some locations than others? And that's another whole idea of research that I really would like to dig into a little bit more. There is huge differences between some sites and how effective the cameras are. The other thing that we wanted to look at, and as part of the collision grant, is are there differing effects of ASE on speed and collisions in areas with different levels of social marginalization? Do they work better in higher income areas where they have actually more like quieter roadways? Do they work better? Like we want to look and see what the differences are by socioeconomic status, because we do know that the road traffic environments in lower income areas tend to be much more dangerous. And that's about it. Thank you so much for listening to me, and I'm happy to take any questions.
Sorry. Sorry, yeah, I'm just having difficulty putting oh, there we are. Thank you so much, Linda. That was an excellent presentation, and I'm very appreciative that you went to that you did that presentation at City Hall and you're able to get those extra slides. I think they really add to especially around the current arguments against ASE being a cash grab and being able to supply that information. So I really appreciate that. And I know you've been inundated over the last month to do with ASE, so appreciate you sticking it out and continuing to get the word out there. So yeah, so if people could supply their questions, I do see one. Okay. Oh, they're starting to come in. This is great. Okay, so the first one then is regarding other cities in your study. Are any of them in provinces where the ASE program is at risk of being defunded?
Well, followed, like I know that there's a lot of conversation in Alberta. The cities that are part of our capacity grant that have ASE, if I'm remembering correctly, that would be included in the collision one. This one, the one that I just presented was just City of Toronto, is Alberta, Calgary. We have Saskatoon, we have Victoria and BC, we have Ontario, Guelph, Toronto. I'm trying to remember it. We also have a capacity city in Nova Scotia, Halifax. So we're covering many of the provinces with if we get the collision study funded.
Okay, thank you so much. And there's a second question here. Okay, this person, I'll just read this. The idea of deploying cameras in school zones is really interesting, but often schools are located on more local streets where there is not much traffic outside of school hours. We suspect that radars are very effective at the beginning of the implementation, but since it always involves the same users, that is the parents, the radar should no longer give many infractions after a certain time, making the radar less useful. What is your opinion on this? Would it be better to have mobile radars with an element that remains on site so that motorists do not know that the radar is rotating at other sites? It's a good one.
A lot in that. First of
Yeah.
all, a lot of schools actually do border on collector roadways and minor arterials. It's actually amazing how many of the schools in the city actually are not deeply embedded in local neighborhoods. There are some, but there are also many that are actually on Avenue Road or on Bathurst Street and things like that. So that's number one. If it's effective in slowing traffic down while they're there, that's fantastic. We cannot, by law, trick people. So you can't pretend to have something there that actually isn't there, and hence the warning periods. They had to put the warning in beforehand to let people know that they're coming. There is a lot of conversation around who actually is speeding around the schools. Is it the parents, or is it people driving through the neighborhoods or to get away from traffic? Um, we had gone down this road actually with the city of Guelph to try and see whether or not we could find out who it is actually driving through the school neighborhoods. But unfortunately, because of all sorts of privacy things, we cannot get license plates. So there is some literature that shows that a lot of the driving infractions that do happen around schools may not actually be the people who live in the area and may not be the parents, but we don't know that for sure. The cameras do rotate. I do know that the city is talking about, if things don't get canceled today, there are a few permanent ones, and they're planning on putting in a few more permanent ones on really, really problematic roadways. But for now, most of them are rotating.
Okay, very good. And you'd mentioned before, showed a slide that showed that when the cameras were moved away, that the savings, I should say the effect of the cameras at slowing them down diverted back to what it normally was, I guess, which is excessive speeding. Um, can you speak to that?
So that's unfortunate. I mean, we wanted to see that there was a lasting effect. I do firmly believe, and I may be naive, but that over time, if we have these cameras throughout the city, generally the behavior will be, as people get used to the idea that they're here and they're moving and they're driving through these neighborhoods, that people tend to slow down. And I do think there is some evidence that that may happen. Not evidence, but there's suggestions and other stuff, like as things progress, as automated speed enforcement becomes better known. I've heard anecdotally people say, yeah, now I drive slowly any time I get to a neighborhood because I'm not really sure where the cameras are in this neighborhood because I don't live in this neighborhood. So what I'm hoping over time, they haven't been around in our city for very long, that people will just get the message to slow down generally, like throughout the city and especially in local neighborhoods.
Yeah, and I've heard that in Calgary it's very much like that, that it's throughout their community safety zones, and I think that is the mindset from my recollection, that people just know you've got to slow down, so it becomes like second nature for people.
Yeah.
Okay, very good. And we've got another question here. Great research and great presentation. Public education on speeding has been a big challenge. As you suggest, many think, oh, it was only 10 kilometers over the limit. I really think the infographic on death risk versus speed traveled should be broadcasted far and wide on billboards, magazines, social media, etc. How do we do that? I'm finding it a great slog to get media to pick up on this infographic. Any thoughts?
Um, it's a World Health Organization graphic. Um, I don't know. I mean, that's not my area of expertise for sure. I'm wondering if I mean, the World Safety Organizations could use that infographic and distribute it, Parachute, maybe. We could chat about that. Yeah, it should be all over the place, especially now that this is such a controversial topic. And as of today, we may no longer have automated speed enforcement in the province of Ontario. But again, this is a Canadian-wide audience. We really do need to get that message across that 10 kilometers per hour is huge in terms of survival. And I do have to actually add, that's overall population. That's not kids. The percentage will be much, much higher fatalities at those different speeds if you're looking at children.
Yeah, and it really resonated with me when you mentioned about the height of the kids and the fact that it is their heads, brains, and they get much more of a brunt of the collision, and especially with the higher vehicles that we have now,
Mhm.
and the more difficulty it is to see children, which are shorter and so forth. So, no, very good point. Something I've heard from the provincial government, from their Minister of Transportation, is something like we want to put more money towards uh, methods that slow speed now, not down the road. So it's not acting right away. The speed camera. They'll learn, X number of days or weeks afterwards that they were caught speeding. So there's that argument. Obviously, you showed in your analysis that it's an over time thing. It's like a deterrent, and people learn over time. But I'm just curious how you would react to that argument.
So the provincial government has been talking a lot about let's get rid of these and put money into speed humps and road narrowings and all the stuff we've been talking about for years that are very effective. I mean, we did a study years ago that speed humps really, really do we looked at collisions, particularly in kids, had a huge effect on collision reduction. You cannot put speed humps on arterial roadways and collectors. You can't put speed humps going down Yonge Street or on Avenue Road. And again, a lot of these schools are facing onto these roadways. Number one, for a variety of reasons. Also, think about our ambulance or EMS services. You cannot put speed humps all over the city. Yeah, sure, they work, but it's not viable. The other thing is with a lot of these suggested interventions, they take a long time to get passed through any political approval process, and they cost a lot of money. Sure, we would love to see more done in the local neighborhoods in terms of maybe the medians and the road narrowings and roundabouts even, but they don't the process is so slow and the amount of money that goes into so automated speed enforcement is the plan is to do it in conjunction with the development of these things, not to replace them. um and yeah, they are extremely effective. The other thing that I do want to mention is um he talked about, I mean, bigger signs, sure, warning signs, but also the lines and signs, I call them, around schools. We looked at this years ago when they first started Vision Zero in the city. What the initial interventions were not very much focused on changing the roadway configuration. There was no automated speed enforcement, but it was painting lines, school warning signs, flashing lights. It reduced speeds a tiny bit. They hardly work. So the lines and signs themselves do not work. You need something physically stopping people from going fast, hence the road configuration and the speed humps, or you need enforcement. It's the only way things are going to work.
Excellent argument. That's great. Another question is, are there studies that look at speeds and speed changes on nearby roads? Do drivers increase their speeds on other roads to compensate for slower speeds on ASE roads?
Thank you for that question. That is something we want to look at with the collisions, especially. Because you can imagine how hard it is to get speed data. We really, really realize that this might, but we call it a halo, like whether or not there's effects on the outside surrounding roadways. But the cities don't regularly, routinely collect speed data on every single roadway. So for us, especially in local neighborhoods, you may get like speed data on some of the major roads, but you don't get them on the smaller local roadways. So it's impossible to actually get speed data. Like this study was very focused on the roadways that had the automated speed enforcement. To be able to do that is a big deal. If we were looking at collisions, we can do that easily because we can actually locate collisions as an outcome. But speed data is really hard to come by. So we don't know what the effects are around the roadways, but if we were looking at collisions, we'd be able to at least be able to know what that effect would be.
Yeah, and I hope you do get that studies
Yeah.
funded because that would be excellent. There's a lot of great questions it would answer. Okay, another question is, are many schools located adjacent to community centers where non-school users, such as parents, seniors, preschool children, visit to attend programs? These people are also vulnerable.
So, I mean, I don't know 100% exactly where everything is located, but these are community safety zones. So those zones have schools and community centers in them. The great point, I mean, it's not just school kids, it's parents walking the school kids. Seniors tend to be in those areas as well. Um, there's an argument out there right now that we should only have them on from 8 till 5 or something like that during the school day. To me, that is so not appropriate because there's after school programs, there's daycare after school in the schools. The community centers, which are nearby, have all sorts of programs going on all evening. Some of the schools are used for evening programs. These schools and community centers are in a focal point of communities. And that means there's going to be a lot of vulnerable road users around them, hence the need to slow the speed down. You're right, like the seniors are very vulnerable also to these types of collisions.
Yeah. And like what we were talking before, you need to get them into a mindset that when they've entered certain areas, they need to slow down. And it can't be something you think, oh, well, what time is it? Oh, I can go a bit faster. It's better to be consistent
Yeah.
and get consistent behavior. Okay, so another comment, and you already did address this. Maybe we just need to install empty camera boxes. But you had mentioned before you can't legally do that. I mean, that obviously would be a deterrent, I guess, but yeah, we can't legally do that. Uh, Another question is, are there any studies that compare the impact of ASE with road diet interventions? One advantage of the latter is that they usually are more permanent. And you were
So that
mentioning before about different built infrastructure or yeah, infrastructure, like how that impacts with that.
I mean, as I said, there's a lot of features of the road diets that work really well. To directly compare would be really difficult because an ASC would be put in a different location than a road diet would be. And if it would be hard to find the control, like the area that didn't get it, because the road diet intervention would be a different probably type of roadway than the ASC would be put on. Or if it is a similar type of roadway, how do you know without doing both how it's working? So you need the roadway to be good, the control, you can't do both. So there are lots of studies that show different types of road diet interventions that do work. I mean, but not to directly compare them.
Okay, great, thanks. Another person asked, police park empty police cars to slow traffic down. Um, we should be able to add ASE signage. And I'm wondering if he's suggesting where there isn't going to be ASE. Same sort of ideas, parking an empty car. But again, though, I guess you can't legally do that. You have to, yeah. Okay.
I don't know how, if like, I would like to find out from the police how they do that, but yeah, you can't do it with the cameras.
Yeah, okay. And another question is that as drivers would tend to slow on the immediate approach to the ASE unit and speed up once immediately past the unit, could the study consider placing the tubes at a position farther downstream from the ASE um, so, to ascertain the retention of slower speeds over a downstream zone rather than at a specific location? That's a good point.
Yeah, I mean, for sure you could do something like that. We didn't build that into our study. I guess the question is to to find out how long along that particular roadways the effects maintain. I mean, the problem is people turn. Um, And but yes, that is definitely something that would kind of be interesting. If we were going to look at this spatial halo effect, that was something that was built in, is what happens downstream from the roadway. And we were going to look at different buffers downstream, but also on the roadways around the cameras.
Okay. Yeah, I'm curious with you mentioned all the other research at the beginning, and not a lot of it, well, none of it had looked at urban centers. I'm just curious if they found, did any of those look long term to see, I guess a little bit different than what the last person was asking about. He was talking about in terms of the area, but I'm wondering in terms of time,
Yeah.
if they looked long term, because you said when you moved the mobile units away, it reverted back, but if they kept those units in the place, did it continue to have that slowing effect?
So that's looking at the permanent camera.
Yeah, yeah, exactly. Yeah.
And I'm not sure. I'd have to go
Oh,
back
because
and look, but I do know that there are cities like Montreal has permanent cameras. I think they only have 7 of them. Um,
okay.
and again, that's one of the cities we do want to look at.
Yeah.
It's as you can imagine, it's quite complicated to design these studies with some cities having permanent cameras, some cities having mobile cameras, and trying to track the cities with permanent cameras are easy to evaluate, exactly how you just said it. But the ones that move, you actually have to like work so closely with the city to find out the exact dates that they're being moved. Especially if you're looking at collisions, because we want to know whether or not it would happen. The camera was actually there when the collision happened or not, right? But the speed, we got the dates when we got the speed measurements. So I'm not sure. I would like to hope that the speeds stayed or continue to go down. I do think there's probably like a bit of a ceiling effect where things bottom out in terms of the percent speeding with the fixed cameras.
Okay, great. And I'm just curious, the whole methodology of using mobile cameras, is it a cost saving measure so that you can cover more area that you can I'm just curious why it is mobile cameras compared to permanent.
I don't want to speak for the city. Is anybody here?
Oh, okay.
But
Sorry.
I would think that you I think probably part of it was just introducing like you can I don't think they're super expensive, but some of it is you just
Okay.
can't keep cameras sitting there forever.
Okay.
I do know that and that's why they're increasing them gradually, but also
Yeah.
I do know that they do have several permanent counters on very specific roadways that are a big problem.
Okay. Okay. Very good. And just see if there's any more that have been provided. Um,
Mm.
Sorry, I can't see this one for some reason. Oh, here, so let me pull it up here. You can effectively install temporary road diet interventions with bollards, planters, barriers. In theory, you could install these and measure effect on speed, then remove them, install ASE to make a comparison. And I think that was in response to your saying that you got to look at things independently to know which one is having the effects. So that's a good point. Did you have any comment for that?
Just that would be a city initiative,
Okay.
because there's no way we could get that like that. That would have to be something that they'd really, really want to do, to be able to go in and put stuff in and then take them out and put something else in.
Right.
And sure, that would be great, but I think it would be difficult to organize, but yeah.
Okay, and just one other question that I had. You'd mentioned that when you were doing a summary of what your results had showed, that there was extreme speeding was still an issue, and I just wondered if you wanted to comment on that.
Um, Again, I don't know offhand. I would suspect that's happening at nighttime. Um, because we're recording 24 hours.
Yeah.
So that's my one comment. I would love to hope that it's not happening in the middle of the day when kids are walking around. We probably should take a look a little bit further about where those sites were. I mean, I kind of think of maybe somebody speeding down Avenue Road in front of Allenby Public School or something at 1 o'clock in the morning. Like that's what I was kind of thinking, but I don't know for a fact. That's something we need to look at a little bit more. And what is it that we need to do to stop this?
Right. So for the majority of people, the deterrence of it if changes their behavior, but there's that odd one that is very risk-taking and
Yeah.
it's difficult to affect that person. Okay. All right. Well, that's wonderful. Thank you so much. Excellent presentation and a lot of great stuff to think about. And we all wish you luck in getting the funding for that other study that you mentioned, where yeah, you're looking at collisions rather than at speeds. And no, great timing, and we'll all keep our fingers crossed that we won't have to take out our ASE programs here in Ontario. So we'll keep up that fight. But once again, thank you so much for coming and for your time. Really
Okay.
appreciate it.
Again, if anybody has any more questions, they can email me directly at linda.rothman@torontomu.ca.
Perfect. Thank you so much, Linda. Okay, have a great day,
Bye-bye.
everybody. Take care.